So today we are going to study about joints. So the joint is basically also known as arthrosis or articulation. Arthrosis means the articulation. So a joint is meeting point between the two or more bones. There may be movement between them or no movement between them. A joint is not only between the bones but also between the cartilaginous, between the bones and tooth. Okay, so today we are going to study about the classification mainly. So the classification of the joint is basically of three types. First is regional functional classification, second is regional classification, and third one is structural classification. So today we are going to cover the classification of the bones. So in functional classification we basically study about the movements between the joints. So there is movement or no movement or slightly movable. Okay, so in the functional classification we study about the movements. So first one, there is immovable joints. Immovable joints are the joints that are not movable. So these are also known as synarthrosis. Okay, slightly movable also known as amphiarthrosis, and movable joints also known as diarthrosis. So in the synarthrosis, the joints are fibrous joints. So the joints are made up of fibrous cartilage. Okay, so there is no movements like sutures. Sutures are present inside the skull. Okay. Next one is slightly movable. Slightly movable also known as amphiarthrosis. Amphiarthrosis is made up of cartilaginous or fibrocartilaginous joints. Okay, so these are slightly movable. So the example is pubic symphysis. As we can know about the pubic symphysis is the joint that is present inside the hip. So the okay, next one is a manubral sternal joint. So manubral or sternum bones, the joint between present inside the manubrium and sternum, or is known as manubral sternal joint. So the next is intervertebral disc. Intervertebral disc is present inside the spine. Our spine, the disc present between the spines, they are known as intervertebral disc. Next one is sacrococcygeal symphysis. Okay, so the inside the coccyx joint. Okay, so next one is movable joints. Movable joints are also known as diarthrosis. Diarthrosis are basically synovial joints. Because of the presence of the synovial fluid, these are known as synovial joints or diarthrosis. These are highly movable, like hip joint, like our knee joint, like shoulder joints. So these joints are basically highly movable. So these are known as movable joints or diarthrosis. So we cover the functional classification. Next we are going to study about the regional classification. So inside the regional classification, these are the types, like skull type, vertebral type, or limb type. So the skull type is our fibrous joint. Vertebral type is about the slightly movable, like intervertebral disc. We studied about intervertebral disc. So these are vertebral joints. And next one is about limb joints. Okay, so limb joints are freely movable, like I told about the knee joint, hip joint. So these are limb joint. Okay, so next classification is structural classification. So inside the structural classification we cover the basically the anatomical structure. Okay, so inside the anatomical structures, the joints are fibrous joint, cartilaginous joint, and synovial joints. So the fibrous joints are classified into three groups: the sutures, the syndesmosis, and gomphosis. Okay, so cartilaginous joints are the classification of cartilaginous joint is primary and secondary classification. So inside the fibrous joint, first one is sutures. So sutures are present, I have told previously that the sutures are present in the skull. Okay, so the sutures, so bones are joints with each other like fibrous connective tissue. So fibrous joint, immovable joints, thus there is no movement between the structure. These are known as synarthrosis. Okay, so the sutures of the skull. Next one we studied about the syndesmosis. So other classification is other classification of fibrous joint is syndesmosis. Syndesmosis, the example of syndesmosis is radioulnar joint and tibiofibular joint. Okay, so inside the syndesmosis, the bones are joined by dense connective tissue. Okay, so these are like interosseous ligament or membrane. So the interosseous ligament or membrane occurs inside the syndesmosis. They permit little movements. So little movements like tibiofibular joint or radioulnar joint. So radioulnar joint are like this. This is radius and this is ulna. So radioulnar joint, the movement is very slightly. So very slightly movement they permit very slight movement. So these are known as syndesmosis. Next is gomphosis. Gomphosis is also known as peg and socket. Here the root, like peg and socket, is they are also known as peg and socket because the root of the our tooth and the socket jaw is attached, so they make a gomphosis. So the root of the tooth and the socket of the jaw are connected together and form a gomphosis. So these are known as gomphosis. Next joint is second joint is cartilaginous joint. So inside cartilaginous joint we study primary and secondary. So cartilaginous joint, first primary cartilaginous joint, also known as synchondrosis joints. Here the bones are joined with each other by cartilaginous plate of hyaline cartilage. So inside this the hyaline cartilage is present. So the example of these joints are emphyseal plate. Okay. So next joint is symphysis. Symphysis or secondary cartilaginous joint. Synchondrosis and symphysis are present inside the cartilaginous joint. So the secondary cartilaginous joint, the bones are the joints by permit fibrocartilage. There is hyaline cartilage and there is fibrocartilage. These are slightly movable like intervertebral disc, like we studied in the slightly movable joint. So these are also known as slightly movable. So intervertebral disc, manubrium and sterna, manubriosterna joint. So next joint is synovial joint. Synovial joint I make you study in the next video the synovial joint briefly. Synovial joints are very important joint because these are present very vastly inside our body. So every joint, every limb joint is made up of synovial joint because there is synovial cavity, synovial fluid. These are very important to know. So in the next video I make you study about the synovial joint. So thank you. This is our video of classification of the joints. If you like, then subscribe to my channel.